Good Saturday morning. I am posting this informational session on COVID-19 because we have been getting a lot of questions. I'm getting a lot of direct message questions and of course from the media as well regarding some of the more hot topics related to COVID. One is antibody testing, which I know is something a lot of people are talking about, a blood test that looks for antibodies to see if you have been exposed to COVID-19. I think what's important to remember here is those tests do not tell you if you have COVID-19 right now. The RNA swabs that are being done at the testing centers are the best tests for that. So if you're concerned that you may have the infection currently, that's where you need to go for testing. The blood testing is good for a lot of reasons, but in particular, as medical professionals, it's important to us because it allows us to know over time how many people were infected and also whether or not we're developing immunity to this particular virus. So some of the people who have been infected in hospitals have had blood testing done after the fact, and they are developing antibodies, which is a good sign that people are developing immunity towards this particular virus, which means a vaccine could also be helpful. The only concern is we don't know whether or not the immunity is long lasting. So if you do have antibodies, that's a good sign for now, but you still may have to have a vaccine in the fall when that is available, or even in a couple of years, because the immunity could wane over time. So that was one of the big questions we were getting. The other one was about the peak. The peak of COVID-19 here in the United States today is supposed to be the peak for us, April 11th. And for the state of Florida, it's been moved up to April 21st. So that's good. The sooner we reach the peak, the sooner we can get over this. So we reach the peak very quickly. And when we talk about peak, we're talking about number of ICU beds being utilized, hospitalizations, number of positive tests, and deaths from coronavirus. The United States should be reaching its peak today, which means over the next few weeks, we should see these numbers drop. And that's all very, very good for all of us. And here in Florida, the peak was supposed to be May 3rd. It's been moved up to April 21st. So we're about 10 days away from our peak as well. So we've got to hang tight for a little bit longer before we can see the light at the end of the tunnel. And then finally, I want to thank many of you. I had a little sappy post last weekend about meeting somebody at a grocery store, and so I want to thank you for all the comments. It was put on there so that we can all kind of understand that we're going through things a little differently, and that we all face our challenges in different ways, and some of us bottle it up more than others. But just remember, we're all in this together. We're almost through it, and just maybe hang tight a little bit longer. Okay, talk to you soon. Bye bye now.